You and I in a series of getting and staying healthy together. I'm proud to have Dr. Bill Frazier in the studio again, plastic surgeon in Vero Beach, Vero Cosmetic Surgery and MediSpa. Botox, fillers, and complexion is what we're going to be talking about today, how you can have non-invasive surgery. Good morning, Dr. Frazier.
Good morning, Rhett.
Great to see you again.
It's nice to be here.
Now, where are you from originally, Doc?
From Connecticut, and moved around in a number of places. Family started in Old Greenwich, Connecticut, and I ended up in New Haven at Yale on the faculty, and then came down here to Vero Beach.
Wow, so you're a Yale professor. Wow, so I can call you professor or doctor or both?
I was an associate professor.
Hey, professor's a professor, you know? You must have really enjoyed that, I bet you.
I enjoyed it very much. I really enjoy teaching and helping people to understand about the practice of medicine. I find it very exciting.
I wish they paid more than maybe they attract guys like you to stick around doing that.
Well, that was exactly why I left Yale, and when we talked about it, they said, well, it's a real privilege to be at Yale. And I said, well, you can't eat the ivy.
That's right.
and so I ended up in Vero Beach.
Yeah, privilege is privilege, prestige is prestige. But anyway, you landed in a great spot. Wouldn't you agree that this is just a heavenly little seaside village, is it not?
It is. It's sort of a distillation of a lot of the northern and central states' people, and they settle here in many cases, for just half the year. But that's when we have our season, and we get to enjoy the intellectual stimulation of these people, and then we get to rest during the summertime and get to go fishing.
It's great to have you here, Dr. Bill Frazier. And we are in this beautiful town, and like I said, people from around the world want to come here. There's more Fortune 500 retired CEOs at this zip code than any zip code in the United States of America, and so it's a very prosperous. But as you know, we're not an arrogant place. It's nice. It's like some other maybe areas just a little south of us. We get to live in this pristine environment. Now, that being said, for instance, I've lost some weight recently, a little over 30 pounds. And I've got some things now that I'd like to tighten up on my body. And you said there are some non-invasive treatments for men like myself, right, Dr. Frazier? And by the way, in case you don't, I forgot to introduce him. He is a plastic surgeon and the owner of Vero Cosmetic Surgery and MediSpa.
Well, there are many things that can be done to tighten skin, and one of the things I always discuss with patients is what the motivation is to do something, and frequently it's they're unhappy with the way they look. And then the second challenge is to figure out what is it that they're really unhappy about as opposed to what they point to. In other words, sometimes a person may point to their neck and say, I'm very unhappy about this loose skin. If I could get it fixed, I'd be so happy. And I look at their eyes, and the eyebrows are down, and the skin is loose, and they have furrows between their brows. They look very angry. They've got brown spots all over their face, and I make them name them, and it turns out they're called age spots. There's a better name, but age spots. And so we start doing this sort of motivational analysis, and it turns out that for many people, I would say probably 7 out of 10, they are very happy if you do non-invasive procedures. Fix their eyes. You might have to do a little surgery there, use some Botox to take away the frown, do some intense pulse light treatment to get rid of the age spots.
Well, invasive is a pejorative term. I mean, people would prefer not to have invasive.
Sure.
You do a lot of invasive surgeries, though, every day. I mean, 6, 8 a day, right?
Absolutely. That's what surgery is about. Basically cutting and sewing something. Yeah. But there are so many things that can and should be done first, because that way you can figure out who's going to be happy with less. And you save them money, you save them risk, they're still happy. I mean, that's really the goal here, is to help people to be happy with themselves.
Now, I want to get to the females, and maybe we'll do that the next segment in a minute. But first of all, let's focus in on men, only because you gave me permission to broach this subject. I think a lot of men feel ill at ease, and maybe we could make them feel comfortable over the airwaves to not be apprehensive about coming in and seeing a doctor such as yourself.
The thing about men is that the tendency in medicine is to treat men and women as the same when it comes to aesthetics, and they're not. You've seen some well-known people recently who've had facelifts, men, and they have a very feminine look afterwards.
Like Kenny Rogers.
Yes, and that's not a good outcome from the aesthetic standpoint. So we want to be sure that we're looking at the three key things with a man. As for a woman, look at their eyes. You want to be sure they're, because that's what everybody focuses on first when you meet somebody new.
Yes.
You look at their eyes. And then the second is you look at their skin, and you don't think about it, but you do. That helps to assess how old do they look, and are they an indoor person, outdoor person, are they healthy or not. And then we come back, look at their eyes, and drop down and look at their mouth. So those are the three things that you start looking at, and that's where the discussion, I think, has to start. Motivation, and then those three anatomic areas.
What secret could you give us that women want to see in a man?
They want security.
So how do we portray that physiologically in what you do?
That's a little tricky. I mean, women in general, and I don't want to generalize too much, but they want somebody who will offer them security, respect, who has enough money to take care of them. So that means they have to have a job that doesn't have to be a prestigious job, but they need to be secure in themselves and secure in their sort of financial life. And appearances aren't so important in that sense. However, there are some things. I mean, women also don't want to be with a person who doesn't take care of themselves,
right,
who has tired, baggy eyes and an angry look on his face just because of the way the muscles work.
Or a gut that looks slothful.
Yes. So there are aesthetic elements to this assessment. I mean, there's some appearance problems that are going to be a real turnoff, but there's, I think, a wide range of acceptable appearances if that person is nice, and if their personality is nice, and if their eyes look nice, because that's what people will look at. That's why I keep coming back to saying, be sure that their eyes look well. That's the starting point, and that can either start the relationship or finish it. Right there.
Oh yeah. Now, in where we live now, we have an elder clientele. Basically, people are 45 plus in this market. One of the first thing that happens is this. I have a friend. He's 89 years of age, but he had the surgery where the bag started coming down over his eyes. And I have another friend. How do you broach the subject and say, I know somebody that can rectify that situation? Because that sleepy eye syndrome.
Well, I think you can just approach it very directly. Says, does it bother you? Do you have trouble seeing, like when you come to a traffic light and you have to look up, or you're looking for something on a shelf and you have to tilt your head back? Does that skin get in the way? And if they say yes, well, that's covered by insurance. Insurance will pay for it.
My friend looks literally instantly 20 years younger by having that eye lift above the eyes.
Mm-hmm. That can make a big difference. And the other thing is, a relationship can make a big difference, and particularly for elderly people. Frequently, they're widow or widowers, and when they can find the right person, they don't like to think about getting remarried, but that is something that may happen, and when it does, I've seen this so many times, their eyes light up. It's like magic, and it's better than anything we can do surgically or with Botox or any other plastic surgery technique.
Yeah, did you ever notice you have these alone periods in life? You're in this valley. Suddenly you meet somebody you love, and then all of a sudden, all these other women are coming out of networks because you're exuding that poise and that confidence. That
you look happy, and that's what I was saying earlier. Is security, yes, income, finances, but you want somebody who is happy. Yeah. So and not happy in a silly sense, but they have a positive outlook on life.
Got to take a break. We'll continue our conversation. We're going to get into what women want and what's affordable to improve your looks with Dr. Bill Frazier, plastic surgeon in Vero Beach, Vero Cosmetic Surgery, and MediSpa. This is the mayor of the airwaves. We'll be right back.